Kia ora GovHack. We are Andrea and Brett, and we are Team Vital Signal. Here to present our project, Local Health Snapshot Generator, unlocking productivity through regional health intelligence. Billions have been poured into digital health. Yet somehow, New Zealand still doesn't have the tools to see how health affects our wallets, workplaces, or even our weekends at the beach. We've got the data, but not the dashboards, and the models out there are about as useful as a chocolate teapot. Enter the Local Health Snapshot Generator. It takes health, education, and socioeconomic data, throws it all together like a well-packed hungy, and serves up region-specific dashboards that actually make sense. Councils, iwi, NGOs and government agencies can see which communities are at risk, put a price on poor health, plan interventions, and make sure it all scales with national standards. Exportable reports mean you can show the numbers off to whoever needs convincing, funding bodies, policy wonks, or even your neighbor who reckons he's got all the answers because he once watched Shortland Street. The magic's in the data. Health stats like the NZ Health Survey, hospital events, mental health services, immunization coverage, suicide and mortality data, education and workforce stats for school attendance, employment indicators, and regional labor trends. As well the socioeconomic and housing stats, like deprivation indices, census information, and housing upgrades, the works, it all helps to form a bigger picture. Pulling it together, the dashboard models measurable outcomes such as reduced avoidable emergency visits, improved school attendance, fewer workforce sick days, and increased GDP from higher labor productivity, then calculates both raw and equity-adjusted ROI for targeted support, including preventive care programs, NZ DEP-weighted regional rollouts, and policy or system changes such as referral pathway redesign. And yeah, it's aggregated, privacy-safe, and built to play nicely with national standards. Other dashboards exist, sure. But none bring together health, housing, education, and workforce data in one tidy, productivity-focused package. This tool links health to the economy, gives local decision-makers something they can actually act on, and makes public data useful rather than just available. The business case framework makes it real. The cost of inaction is lost productivity, avoidable healthcare bills, and maybe a few extra sick days you didn't need. Intervention modeling shows where targeted programs can actually move the needle. ROI calculations, 3 to 5 years of conservative estimates that still look pretty healthy. Stakeholders, individuals, businesses, and governments all get to see the wins with healthier communities, a more productive workforce, lower costs, and planning that doesn't feel like guesswork. In mid-range projections, based on moderate uptake and realistic implementation speed, in 4 years, projected savings up to $10 million with return on investment of 88 times the cost, GDP uplift of $5 million from improved workforce participation, and reduced absenteeism. Look, if data could talk, it would say, bro, I told you this ages ago. The strategic fit and next steps. This tool isn't just a toy for data nerds. It supports national initiatives, shows Tawhatu Aura's interoperability platform in action, and ticks GovHack's challenge to link health data to productivity. Next steps. Build a minimum viable product with NZ Health Survey, NZ DEP, and school attendance data. Validate ROI with healthy homes interventions and mental health support. Expand to include employment and hospital discharge datasets. Plug into Tawhatu Aura's API gateway so it grows without breaking anything. What catapults this beyond the ordinary is, it's a dashboard that doesn't just sit on your desk like a boring ornament. It's actionable, cross-sector, and actually makes the numbers matter. Vital Signal is a fair dinkum thinkum tool for Kiwis who like the data with a side of sense. And hey, if laughter is the best medicine, then dashboards are, maybe third. They don't fix your flu, but at least they won't keep you for 6 hours waiting in the emergency department. Thank you for your time. Ngā mihi, GovHack 2025.
The build is almost completed.
Refactoring data should not be this hard, Arg.